are you? Hashimoto's thyroiditis, also called Hashimoto's disease, is a serious autoimmune condition and is the most common organ-specific autoimmune disorder. A person's immune system begins to recognize its own thyroid cells as foreign and begins to attack them. The theory is that an underlying autoimmune disease brings about the development of fibromyalgia and Hashimoto's. Studies have found that the presence of autoantibodies called thyroglobulin and thyroid peroxidase are 2 times higher among fibromyalgia patients than healthy individuals. 2 times. This observation suggests that fibromyalgia pathogenesis may be supported by thyroid autoimmunity. So that's what I'd like to talk about today. Let me first say that I've known about this connection for a while, but at the time, I had a great deal of issues happening at the same time. So I put this on the back burner. I had orthostatic intolerance, GERD, IBS, eye issues, and obstructive sleep apnea that caused me concern because at the time I was still working. So I felt a little overwhelmed. I want to thank one of my subscribers, Merlin Meadow, for recommending Martin Rutherford's channel. I put a link to his playlist on Hashimoto's below. Also, this video is much longer than I anticipated when I started my research. So there are timestamps if you want to skip around, but I hope you make it to the end. A positive ANA test is seen in 45% of patients from the general population where thyroid antibodies were present. TPO antibodies were shown to be present in 30% of female patients in the general population, which is higher than 16 to 20% of those without an ANA positivity in the general female population. Hashimoto's is more common in women with a 5-to-1 to a 10-to-1 ratio. During pregnancy, the serum concentrations of thyroid antibodies decrease, but during the postpartum period, is found to be the forerunner of permanent autoimmune hypothyroidism. Maternal immune responses against foreign fetal antigens might trigger autoimmune diseases, as studies have stated. Hashimoto's disease is the most common cause of hypothyroidism. It causes your thyroid to not make enough thyroid hormone. Fibromyalgia is prevalent in 30 to 40% of people with Hashimoto's disease, and up to 44% of people with hypothyroidism also have fibromyalgia. Thyroid disease and fibromyalgia normally begin most commonly in childbearing age and in middle age, but can occur at any time. So the 2 blood tests for Hashimoto's are anti-thyroperoxidase, usually called TPO antibodies test, and anti-thyroglobulin called TG antibodies test. The TSH test, thyroid stimulating hormone, is often normal on tests, so if you get a normal result, it's suggested to get the other 2 tests. Because TPO antibodies are found in nearly all people with Hashimoto's thyroid disease. But a TSH test often indicates hypothyroidism. The presence of autoantibodies of thyroglobulin and thyroid peroxidase are 2 times higher among fibromyalgia patients compared to healthy individuals. But fibro patients with a fully functional thyroid gland also have higher levels of thyroid peroxidase autoantibodies in the blood. This is why it's been suggested that fibromyalgia pathogenesis could be supported by thyroid autoimmunity. The root cause of Hashimoto's and fibromyalgia is suggested to be the dysfunction of the hypothalamus in the brain. The hypothalamus is a region of the brain that regulates hormone levels, also sleep, temperature, hunger, and the autonomic nervous system, which controls our blood pressure, blood flow, digestion, and much more. And other hormone problems that stress the body, like infections, have been associated with both fibromyalgia and thyroid disease. If you have a family history of thyroid disease, your risk increases. And if you have another autoimmune disease, your risk increases. Although the connection between fibromyalgia and thyroid disease is still unclear, it's important to be aware of thyroid disease in fibromyalgia and talk to your healthcare provider. I plan to do that with my next doctor appointment. In most people, Hashimoto's comes on slowly. It's progressive and results in thyroid gland destruction. It can take on average 10 years for the disease to show up on tests. Immune cells will congregate in the thyroid gland. And the problem is that Hashimoto's is not usually discovered until it has progressed to the advanced stages, which I'll talk about the stages here shortly. When significant damage has occurred, this is because the conventional test that most doctors use is that TSH test, the one that I had done, and mine was normal. Before the TH level is detected, though, other blood tests should be considered, like the TPO and the TG antibody tests, because those are what are needed to discover Hashimoto's. I haven't had those tests yet. If the condition is detected earlier, damage to the thyroid gland can be prevented. Thyroid ultrasounds can also help. If your doctor won't order the test or your insurance won't cover it, there is a lab that you can request called the TP Root Cause Thyroid Panel #1, and I've linked that below. If you think this is a possibility, have it checked out, because if left unbalanced, the immune system may attack different parts of the body, leading to the development of other autoimmune conditions. I'm thinking that in some of us, this might be the reason for fibromyalgia. There are 5 stages of Hashimoto's illness. Stage 1 is a genetic predisposition for Hashimoto's, and yet you may not have been exposed to the triggers. So normal TSH and T4 and T3 levels will resolve. They won't have thyroid antibodies either. This could be considered state 0, but if you have thyroid disease, this may be the stage your children or relatives are in. Also, if you have a family member with thyroid disease, this could be the stage you're in. Hashimoto's can be explained by 70% inherited genes. This is the time to think about preventing thyroid disease from occurring in the first place. And having another autoimmune condition increases your risk of progressing to Hashimoto's. Stage 2 is when the overabundance of lymphocytes, white blood cells, in the thyroid gland occurs. Small amounts of lymphocytes are important to our health, but when there are too many in an organ, tissue damage begins. At some point, the immune cells begin to attack healthy thyroid tissues. About 50 to 90% of people in this early stage will show an elevation of thyroid antibodies in the blood. You've learned about these to be thyroglobulin and thyroid peroxidase antibodies. Some people who don't have these antibodies, a thyroid ultrasound or biopsy will show the changes in the gland. This stage can go on for decades before you get enough damage to detect the thyroid hormone, TSH, free T3, and free T4 levels. But if you have symptoms like anxiety, fatigue, miscarriage, infertility, mood swings, excess weight, or excess weight loss, your body is working hard to keep the thyroid levels normal, which is exhausting and draining on the other body functions. In addition, gut wall function is impaired. So working on your gut health is important. Antidepressants are often prescribed by doctors. Inflammation has begun, and it's time to work on interventions. Identifying triggers are also important. Many of us have food allergies or food sensitivities, and this should be considered at this point. Ensuring there isn't a nutrient depletion is also important. Removing toxins and working on adrenal function is also important. If you have chronic infections, it's important to take care of those. Many people can reverse these issues by going gluten-free. I put a link to a book by Dr. Isabella Wentz below. In addition, seronegative autoimmune thyroiditis is a less aggressive form of Hashimoto's, but the person may still develop hypothyroidism and even progress to other autoimmune conditions. Seronegative means the thyroid antibodies are not present, but an ultrasound exam is needed. Stage 3 is when the TSH levels may be slightly elevated and T3 and T4 are normal. The antibody tests may be slightly higher than they were in stage 2, but some may still have a negative antibody test. An elevated TSH level means there is inflammation in the thyroid. So extra care needs to occur, and adding a small dose of thyroid medication can help to lower the antibodies. Thyroid medications are the same chemical structure as our internal thyroid hormones, so I tend to advocate for medications that make a difference. And sometimes the person can wean off medication under a doctor's care once the thyroid is under control. Stage 4 is when the thyroid gland fails and hypothyroidism sets in. The thyroid gland becomes destroyed and it cannot make its own thyroid hormone. Elevated TSH and low T3 and T4 are found. This is the stage that most people are diagnosed. Thyroid medications are required at this point to prevent serious health consequences. It's critical to change your lifestyle and determine the root cause. Low-dose naltrexone, also called LDN, is usually prescribed. Stage 5 is when other autoimmune conditions develop. Celiac disease, psoriasis, Sjogren's, rheumatoid arthritis, lupus, MS, and others are common. So this means that other organs are getting attacked. So saliva and tear glands and joints become an issue. The problem is that even with thyroid medication and removing the thyroid gland, do nothing to stop this progression. There are protocols that a person has to follow at this point. Diet, LDN, treating infections, and an elimination diet can help treat the autoimmunity and help reverse it. Symptoms vary among individuals, but may include the following. An enlarged thyroid gland, called a goiter, can occur. If your thyroid isn't making enough hormone, it can cause tiredness, muscle weakness, weight gain, feeling cold, which might make your body hurt more, depression, and hair loss. Or maybe the hair becomes coarser and skin changes can occur. And did you know that GERD, acid reflux, IBS, stomach pain, and constant bloating are also found in Hashimoto's patients? And they will also experience brain fog and possibly carpal tunnel syndrome. Whew, that was a lot. And if you've stayed with me to the end, thank you. I send you gentle hugs and support. Love you. Is a serious autumn unhealthy damage to the thyroid gland, the TP root cause thyroid. Keep your thyroid levels going gluten-free. But the person may still develop hypothyroidism, an elevated TSH thyroid hormone, which might